Well, according to Mississippi State's health officer, Mississippi is ranked last when it comes to receiving adequate health care, but medical professionals are doing what they can to change that. So
Medical professionals from across the nation are coming together for the 10th annual Empowering Communities for a Healthy Mississippi conference, sharing and coordinating resources to improve health services offered in the state as healthcare landscapes continue to evolve.
And share their experiences, to share the latest research, to share the latest information, to really empower. That's one of the things about this conference called Empowering Communities, to really give the tools to organizations and people so they can go back and empower others to take control of their health, take control of their communities, their towns, and their neighborhoods.
Experts say creating a healthier Mississippi starts from the home and goes all the way up to the state level.
We have to improve education regarding health and behaviors. That needs to happen far upstream as we can. I'd like to see it happen and begin at Head Start, but then be educating our school-age children on the importance of healthy activity, healthy eating, and then with our older kids, how not to get syphilis. What is syphilis? What does syphilis mean? What do sexually transmitted infections mean in the 21st century? And give them education so that they can protect themselves.
Mississippi is ranked 50th in maternal mortality and 47th in infant mortality. Healthcare professionals advise, in addition to routine doctor visits, leaning into community resources can help make a difference in pre- and postnatal care.
And then it's also important to use a variety of services that are here in the community, and also using the network, using your family network. I think sometimes we don't talk about that as much as we should, which is also why I like to talk about doulas, because that's a part of your network, right? So whether you officially have a doula or you have an auntie, right, or a friend or a cousin that you can trust to talk about what's going on with you as you're pregnant, I think that's important. But
the healthcare system continues to face a new list of challenges. The latest crisis is a shortage of over 200 medications related to STDs, cancer, diabetes, pregnancies, and other health issues due to pharmaceutical manufacturing. In Flowood, Marie Menefield, 12 News.